Hello and welcome. Today we're diving deep into a complex kidney disease linked to a familiar foe, malaria-associated nephropathy. This condition, a significant cause of kidney damage, affects individuals living in malaria-endemic regions. Join us as we unravel its causes, how it affects the kidneys, how it's diagnosed, and what can be done about it. Malaria-associated nephropathy, at its core, is caused by infection with malaria parasites, primarily Plasmodium falciparum and Plasmodium malariae. However, it's not a direct invasion of the kidneys by the parasite. Instead, the kidney damage is a consequence of the body's immune response to the parasite and the byproducts released during the infection. Chronic and repeated infections are key predisposing factors, particularly in individuals with specific genetic predispositions. The pathophysiology of malaria-associated nephropathy is multifaceted. The malaria parasite triggers a cascade of immune responses. Circulating immune complexes, formed by antibodies binding to parasite antigens, deposit in the kidney's glomeruli, the filtering units. This deposition activates the complement system, further amplifying inflammation and causing glomerular damage. Additionally, the release of cytokines, like TNF-alpha and IL-1, contributes to inflammation and glomerular dysfunction. In severe cases, glomerular scarring, known as glomerulosclerosis, develops, leading to progressive kidney failure. The damage specifically targets the glomeruli, resulting in proteinuria, meaning protein in the urine, which is a hallmark of the disease. Ultimately, this chronic inflammation and glomerular damage reduce the kidney's ability to filter waste products effectively. Malaria-associated nephropathy predominantly affects individuals residing in areas where malaria is endemic, particularly sub-Saharan Africa, Southeast Asia, and parts of South America. Children are particularly vulnerable, especially those with repeated or chronic malaria infections. The prevalence varies depending on the specific geographical location and the intensity of malaria transmission. Factors such as socioeconomic status, access to healthcare, and the prevalence of specific LA types that may predispose individuals to immune-mediated renal damage also influence the epidemiology of the disease. The signs and symptoms of malaria-associated nephropathy can be subtle initially, often developing gradually over time. Proteinuria, or protein in the urine, is a key indicator and may lead to foamy urine. Swelling, also known as edema in the ankles, feet, and around the eyes, is another common symptom, resulting from the kidney's inability to maintain proper fluid balance. High blood pressure, or hypertension, is frequently present as the kidneys play a vital role in blood pressure regulation. As the disease progresses, individuals may experience fatigue, loss of appetite, and general weakness. In severe cases, kidney failure can occur, leading to symptoms such as nausea, vomiting, and shortness of breath. Diagnosis of malaria-associated nephropathy involves a combination of clinical evaluation and laboratory tests. A urine test is essential to detect proteinuria. Blood tests are performed to assess kidney function, including serum creatinine and blood urea nitrogen (albumin) levels. A kidney biopsy may be necessary to confirm the diagnosis and determine the extent of kidney damage. Microscopic examination of the biopsy sample can reveal the presence of immune complex deposits and glomerular scarring. Furthermore, malaria parasite detection through blood smears or rapid diagnostic tests is crucial to confirm the presence of a current or recent malaria infection. Ruling out other causes of kidney disease is also essential. While there aren't distinct types of malaria-associated nephropathy in the same way as some other kidney diseases, the severity of the condition can vary considerably. Some individuals may experience mild proteinuria with minimal kidney damage, while others may progress to end-stage renal disease requiring dialysis or kidney transplantation. The degree of glomerular scarring, the presence of other co-existing kidney diseases, and the individual's overall health status all contribute to the disease's spectrum. Treatment and management of malaria-associated nephropathy focus on several key areas. First and foremost, prompt and effective treatment of the underlying malaria infection is essential. Antimalarial drugs are used to eradicate the parasites from the body. Secondly, managing proteinuria is crucial to slow the progression of kidney damage. Angiotensin-converting enzyme and ACE inhibitors or angiotensin receptor blockers, and ARBs, are often prescribed to reduce protein excretion in the urine and lower blood pressure. Dietary modifications, such as reducing protein intake, may also be recommended. Controlling high blood pressure is vital to protect the kidneys from further damage. Antihypertensive medications are used to maintain blood pressure within a healthy range. In severe cases of kidney failure, dialysis or kidney transplantation may be necessary. Preventing malaria is the most effective way to prevent malaria-associated nephropathy. This involves implementing strategies to reduce malaria transmission, such as using insecticide-treated bed nets, indoor residual spraying, and taking prophylactic antimalarial medication when traveling to endemic areas. Early diagnosis and prompt treatment of malaria infections are also crucial to prevent the development of kidney complications. Public health education programs aimed at raising awareness about malaria prevention and early treatment are essential in endemic regions. The prognosis of malaria-associated nephropathy varies depending on the severity of kidney damage, the promptness of treatment, and the individual's overall health. Early diagnosis and treatment can significantly improve outcomes and slow the progression of the disease. However, if left untreated, malaria-associated nephropathy can lead to end-stage renal disease, requiring dialysis or kidney transplantation. Current research is focused on understanding the specific immune mechanisms involved in kidney damage and identifying potential therapeutic targets. Newer therapies aimed at modulating the immune response and reducing inflammation may offer hope for improving outcomes in the future. There's also ongoing research into the genetic factors that may predispose individuals to this condition, paving the way for personalized prevention strategies.